Hi, I'm Eleanor, and I'm going to talk about the medical terminology for the phases of swallowing. So, swallowing is a complex process that involves many different muscles. Some of those muscles are going to include the levator veli palantini, the suprahyoid muscles, the long pharyngeal muscles, and the pharyngeal constrictors. The levator veli palantini elevates the soft palate to prevent nasal restriction during the pharyngeal phase. The suprahyoid muscles elevate the hyoid bone and larynx, aiding in the airway protection, and that opens the upper esophageal sphincter to facilitate bolus passage. The long pharyngeal muscles elevate and shorten the pharynx, assisting in bolus transport. And then lastly, the pharyngeal constrictors contract sequentially to create a wave-like motion propelling the bolus towards the esophagus. Together, these muscles ensure efficient and safe swallowing, preventing aspiration and promoting smooth bolus transit. And then we will move on to the cranial nerves.
Hi, I'm Sarah Beth, and I'm going to talk about the cranial nerves that are involved with swallowing, the biomechanics, and the oral phases. So first, there are six main cranial nerves involved with swallowing, and that would be the trigeminal, the facial, the vagus, the glossopharyngeal, and the accessory. Oh, and the hypoglossal. So the trigeminal is a motor nerve, and its functions is to help a person chew and clench their teeth. The facial is also a motor nerve, and it's involving the movement of the submandibular glands. The vagus is a sensory and motor nerve that provides sensation to the outer part of the throat, and it also plays a role in taste sensation. The motor aspect of it provides movement to the throat and soft palate. The glossopharyngeal is as well a sensory and motor nerve. The sensory part receives information from the throat, and the motor division provides movement to the diapharyngeus, which is a muscle that allows the throat to shorten and widen. The accessory nerve is a motor nerve that controls the muscles that allow a person to rotate, extend, and flex the neck and shoulders, which helps with the movement of swallowing. And lastly, the hypoglossal nerve is a motor nerve that supplies the tongue muscles. So next I'm going to talk about the four main phases of swallowing, and these are the oral preparatory phase, the oral phase, the pharyngeal phase, and the esophageal phase. Each is important to complete a full swallow process, and each phase can contain problems which result in dysphasia. So the oral preparatory phase is the first stage of swallowing, and this is where the food is masticated, mixed with saliva, and then gathered into a softened mass called a bolus between the tongue and palate. The oral phase is responsible for sucking, mastication, or chewing from the bolus to form a bolus and moving food or liquid into the throat. The pharyngeal phase is the start of the swallowing and squeeze of the bolus down the throat. During this phase, the airway needs to be closed off to keep food or liquids out. And then because food or liquids entering the airway can lead to choking or coughing. And then the last phase of the swallow is the esophageal phase. And during this phase, the esophagus opens and closes, squeezing food down into the stomach. And if there's a problem during this phase of the swallow, aspiration will occur, and the patient may also throw up. So lastly, I'm going to cover the biomechanics of swallowing, and the biomechanic of swallowing involve a series of muscles that all coordinate together to create movements in the mouth, throat, and esophagus. Swallowing is a complex sensory-motor phenomenon involving both the peripheral and central nervous system along with the muscles. In the oral phase, the tongue plays a crucial role in propelling the bolus posteriorly, while the pharyngeal phase involves a cascade of neuromuscular and kinematic events crucial for safe swallowing. These events include hyoid elevation, pharyngeal constriction, and opening and closing of the parapharyngeal segment. In the oral phase, the biomechanics used are lip closure, mastication, salivation, and the tongue. In the pharyngeal stage of swallowing, the biokinetics that are used are the pharyngeal constrictors, larynx, folds, and the upper esophageal sphincter. In the esophageal stage, the biokinetics that are used are peristalsis and the lower esophageal sphincter. And all of these stages are controlled by voluntary and involuntary reflexes. Um, the hyolaryngeal excursion occurs when the hyoid bone and larynx move superiorly and anteriorly. And that covers the technical terms for swallowing.
So now I am going to put it into more simpler terms as if we were explaining to an adult patient. So, um, swallowing happens in four main stages. The first stage is that oral preparatory stage, which is when the food is getting the food ready. You chew the food, you break it down into smaller pieces. Your tongue and your saliva will help mix and shape the food into a soft, more manageable ball in our mouth, in which that would be referred to as the bolus in more technical terms. And if you're drinking the liquid that is gathered on your tongue, that means it's ready to be swallowed. The next stage is going to be the oral stage, and that is moving food to the back of the mouth. So the first step in that phase is going to be your tongue pushes the bolus towards the back of your mouth, and your soft palate, which is the top of your mouth, lifts to keep the food from going up into your nose. So, um, the softer part in our mouth, it lifts to keep our food right there and keep it in place. And this is a very quick stage. It happens in about a second while we're chewing. The next phase is the pharyngeal stage, and that protects the airway and the swallowing. So our throat muscles push the food downward, and our voice box, which is the larynx, and windpipe, which is the trachea, are protected so food doesn't go down the wrong way. So in this visual that we have up, um, that little flap, that like purple blue color, is going to be keeping it from going in the wrong place, away from our lungs. And then the last phase is going to be the esophageal phase, and that's when the food will move down towards our stomach. So the food enters the esophagus and it moves in a wave-like muscle movement and it pushes our food downwards. And the lower esophageal sphincter opens so the food can enter our stomach. And next, I will talk about the structures and their functions of swallowing in terms as if I was speaking to a adult client as well. So, the mouth, the oral cavity, which prepares our food, that's going to include our teeth, of course, to chew and break down the food. That's going to include our tongue, which moves food around, and like I mentioned, it pushes our food back, getting ready for that swallowing. Our salivary glands produce the saliva to moisten the food and make it easier to swallow, breaks it down so it's not as hard. And the soft palate, again, that top of our mouth, when it lifts and keeps it from going into our nose. So the structure would be the mouth and all those parts, and then those functions. Next would be our throat, of course. So it directs food the right way, like I mentioned. The epiglottis is the function, and what it does, I'm sorry, the es epiglottis is the structure, and the function is it's a small flap that closes over our airway so food doesn't go into our lungs as well, like I mentioned. And the pharyngeal muscles, the structure, and then again, the function is it pushes our food down toward the esophagus. Next is going to be our voice box, otherwise known as the larynx, and that protects the airway. So there are vocal cords, the structure, and their purpose is they close tightly to block the food or liquid from entering our lungs. And next structure is the hyoid bone and larynx, and their function together, it moves upward and forward to help close the airway and open the esophagus. And then the esophagus, which again is that part of our body that transports the food from higher to down to into our stomach. So that's going to include the structure of upper esophageal sphincter, and the function of that is it opens to let food enter the esophagus. Next is going to be the esophagus, which it is a muscular tube that pushes the food down in wave-like motions. And lastly, it's going to be the lower esophageal sphincter, which opens to let the food enter the stomach, and then it closes to prevent any acid reflux.